Thank you guys for having me. I probably didn't need the microphone. I have got a big mouth. And I talk long. So I'm going to ask somebody to keep time for me because I will keep going. And Peggy has already told me she's going to sneak out. So everything that Angela told you guys was accurate. I work for the Center for Integrated Oncology at Greenville Health System. We are a part of the Cancer Institute. Can you hear me? I'm a social worker there, but also the distress management coordinator and now program coordinator for a new program that I'm going to talk to you guys some about today. I'm going to talk to you about all of our services and the needs of cancer survivors. I came to Greenville Health System's Cancer Institute about 2 years ago when they implemented this whole distress screening thing. So basically one of our accreditation bodies said that we now need to screen for distress in cancer patients because besides this disease that they're having to deal with, there are other issues that come along with it. Stressors, anxiety, depression, financial issues, all sorts of things that come along with a cancer diagnosis that we should be talking to them about and be aware of to make sure that we are helping address things from all angles. So that's how I ended up here. Let's see if this clicker works for us. There we go. So the Center for Integrated Oncology was established in 2012, and we have grown so much. So we have only been in existence for about 4 years, and they went from a staff of very few people to now we have a little bit over 30. So we do lots of integrated therapies, psychosocial distress and counseling services, which is what I just talked to you some about, and I'll talk to you some more about. We also offer music therapy. We actually just got a full-time music therapist. That is one of the programs that has grown greatly. When I first came on board, we had, I guess, a PRN music therapist. She was with us for maybe 10 to 20 hours a week, so not even part-time. That was 2 years ago. And yesterday, just got our announcement that now we have a full-time music therapist, which is wonderful. Nutritional counseling and classes, smoking cessation, lung cancer, Best Chance Network, that's a new one that I'm going to talk to you guys about today. Integrative Oncology Survivorship Clinic. We're going to go over all of these. The Lifetime Clinic, AYA, is a new clinic that's starting. The lymphedema physical therapy and oncology rehab moving on, and genetic counseling. That is a lot. And we do a lot. CIOS's platform is treating the whole patient. So we use the integrative approach in lots of CAM therapies to address many of the needs that I just talked to you about. But as I'm sure you guys are aware, along with the diagnosis of cancer can come things like fatigue, pain. And so we want to address all of those things, and we do those in a lot of different ways. We have a new acupuncture study going on. We do some mindfulness therapies to help patients deal with anxieties and fatigue, just to minimize the side effects they are experience so that they can effectively go through treatment and hopefully have a better treatment outcome. How many of you in this room have known somebody or have yourselves experienced a cancer diagnosis? Just about everybody. And that's one of the things that we usually tell people or try to educate people on, is that cancer is a disease that really knows no boundaries. It affects everybody, regardless of race, socioeconomic income. It crosses all lines. And so we are really trying to educate and help people get through that diagnosis, whether they are the patient or friend or family member supporting that patient. So addressing needs of the whole patient, which is what I just said, not just their physical. Our survivorship professionals are experts just in treating individual needs and connecting them with the resources that they need. So not just within our own center, but also within the community. There are many times where patients come in and maybe we don't offer the service that is appropriate for them, or maybe they live in a county. Most of our services are in Greenville County, and one of the issues that we've had, even here in Pickens County or in Spartanburg County, is many of our patients don't have the transportation. They want the service but can't get to it. So it may mean referring them out to another community resource so that they can get a similar service or help address those needs. And you guys can stop me at any time if you have questions. You don't have to wait to the end, okay? So again, these are just a list of the integrative therapies that we offer. Essential oils classes is one that I didn't mention. How many of you are familiar with essential oils? Anybody? A few? Yep. We actually have a nurse who is certified in holistic care, and so she has started offering essential oils classes for patients, which is awesome. Herbal remedy classes, mindfulness meditation, which I mentioned. Cancer fighting kitchen and cooking classes is a big one that's offered by our dietitian, who is board certified in oncology, and she does an actual cooking class at the Life Center in Greenville, right across from the hospital, where they actually prepare meals with ingredients that are shown to help fight cancer or build your strength up after a cancer diagnosis, which is really neat. Psychosocial counseling, this is me and Carrie. Carrie Susko is the other social worker with the Cancer Institute. She primarily does counseling, so we offer individual counseling, not just for the patients, but for their families as well, because a cancer diagnosis is a lot to go through, and all the times our patients and our families are not able to talk to one another, or they don't want to, because everybody's trying to protect everybody else. The patient doesn't want to scare the family doesn't really want the patient to know that they are afraid, and so that's why we're here. You guys come and talk to us and tell us what's going on when you are afraid to tell other people, or when you don't want to have that conversation with other people, and we find that to be the case a lot of times. Or maybe you have a family member who's willing to listen, but they just don't get it. And sometimes it can be hard for somebody who hadn't experienced a cancer diagnosis to understand what a cancer patient is going through. CSC, and I don't know if I have a slide on that. I'm gonna go back then. So CSC is community support, the cancer support community, which used to be Gilda's Club. Is anybody familiar with that? So it's a big cancer support group, and it is a national group. We are the first hospital affiliation, where there's just a big calendar of events of different things offered, not just to our patients, but to the upstate community as a whole. Anybody who has suffered a cancer diagnosis or has dealt with one as a family member or friend. So our yoga classes are completely free for cancer patients and their families. The support groups that we offer are completely free for cancer patients and their families. We also they just started a core strength training class, an exercise class, right at the Cancer Institute with our Y Navigator, who is actually an exercise specialist from the YMCA. That's one of the programs they started, trying to get more of the community involved. So patients who couldn't necessarily make it to the Cancer Institute had the option of going to the Kane Halter YMCA in Greenville. But now she's there and doing a core strength training program for patients and their families. They do art groups. We have an art therapy group. I can't remember, it's so long, but I did bring you calendars. On this table over here are a list of, or just different information on our calendars and the different programs that we are offering right now. Music therapy, I told you guys that we just got our full-time music therapist, and music therapy does help with the decreasing of anxiety and stress, management of pain, positive changes in mood. And our music therapist is not just working with our adult cancer patient, but she has also moved into the hospital some and has started working with some of the pediatric patients, and would have been a wonderful person to bring with me. But she told me a story recently of a baby that she was working with who was on hospice. And this is just to give you an idea of some of the stuff that we do. He was 15 months old, and I'm not quite sure what type of cancer he had, but he was with the pediatric hospice staying at Greenville hospital system. And so she worked with the family just to kind of soothe the baby during treatments or when nurses were coming in to give him medicine. And one of the things she did was actually help the family create a personalized lullaby for the baby. And he passed. In fact, he passed the same week she started working with him. But that was something the family will always be able to have. And it did help them cope. They were very grateful that she was involved and said that the music helped soothe the baby during those times. Questions? Y'all are good? Okay. Let's go. So the nutrition services, just like the CSC calendar, those services are free. The stress monitoring and psychosocial counseling, like there is a fee for psychosocial counseling. Usually insurances pick that up, Medicaid or Medicare, but there is no fee for distress management services. So you would still be talking to a counselor, although it might be about more practical things, but there's no fee at all for that, as well as nutritional services. So you could talk to our registered dietitian about your eating needs or the patient's eating needs. Completely free of charge. This is the new program, Woman to Woman, and that is much too small for you to read, so I'm going to talk about it. Woman to Woman is a program of OCRFA, which is the Ovarian Research Cancer Foundation Alliance. They just changed their name. And this program focuses on gynecological cancers of any type, and it is a peer mentoring program so that we are matching new gynecological cancer patients with survivors who have already been there, whether it is an ovarian cancer, whether it is a cervical cancer. You get somebody to meet and talk with and kind of walk you through the stages of this process. And when I say this is new, this program started in September. We are having our first volunteer training this month, actually. This is another program that has been offered to the community as a whole. So this is not just for patients of Greenville Hospital System. Any woman in the upstate area who has experienced a gynecological cancer can come in and participate. So they not only just get mentors, but also a group of support in these ladies coming together. There is some modest financial assistance if the patient needs it, just to kind of rally them on, because it can be a devastating diagnosis. Questions about this? And I bring you information on that as well, whether you know somebody who has had a gynecological cancer and think that they might be able to benefit from it, or if you know a survivor who you think might be a good mentor for somebody else. So, smoking cessation program. We also provide a smoking cessation program for our patients. Usually, we try to encourage everybody not to smoke. Because it is a risk it is a risk factor. I did not. It is a risk factor in cancer. So there's a whole Quit Smart program that we encourage our patients to participate in. This is not just extended to the patient, but to any family members living within the household. Because if you are a smoker or have ever been a smoker, you know it's hard to quit. And if somebody else is smoking and you're trying to quit, that's really rough. So we extend it to everybody. Lung cancer screening program is also a fairly new one. They have started that maybe within the last year, just for patients ages 55 to 77. If you have a tobacco smoking history or a current smoker, you can come in and get screened for lung cancer, which is neat. Best Chance Clinic. This is also a new one. This program is for underinsured or women with no insurance, and its focus is to offer breast exams, pelvic exams, and a pap smear if needed, plus the regular mammogram, which is the breast exam. You just have to be a South Carolina resident, 30 to 64. You either have to have a high deductible insurance that you can't afford, or no coverage at all. Questions? Oh, yeah, yeah, you're right. She's saying that's going to be everybody at some point. So integrative oncology survivorship visit. Usually these visits occur after the patient has had a cancer diagnosis and they follow you throughout. So you get a survivorship care plan, distress screening and evaluation of needs, evaluation of research tools, introductions and or referrals to other complementary or integrative therapies, and education and referrals for ongoing programs at the hospital. So once you've had a cancer diagnosis, once you have maybe gone through treatment and seen your oncologist, a lot of our patients have commented that they miss that community, that the oncology support staff was their support system, the doctors and the nurses and the MAs, and they don't get that because maybe now they're only coming back once every 3 months or once every 6 months, sometimes once a year. And so this is a way of keeping them involved with the medical staff. They can ask questions here if they want to, and still have access to the programs that are being offered. These are the adolescent and young adult life clinic. This is for patients who are 15 through 38. It is offered on our pediatric floor. And I know people are like, 38, that's adolescent and young adult. I'll say yes, because I fall in that range and I want to be considered young. So, but initially I thought the same thing, 38. The gynecological oncology, which is where the woman to woman program is going to be based, focuses on ovarian, uterine, and cervical cancers, providing follow-up for gynecologic exams and knowledge of issue specific to treatment. And then our adult lifetime clinic is similar to the CIOS visit that I told you about, the survivorship visit. Physical therapy and lymphedema management. So many times after a patient has had a cancer diagnosis, especially breast cancer, but not only breast cancer, you can experience some lymphedema. Do you guys know what lymphedema is? Anybody? So she's saying yes, what is it? It is swelling. It can occur anywhere. Most of the time for breast cancer patients, it occurs in their arms after a surgery. But it can occur in legs, just any part of the body once you have experienced a surgery. So we have some lymphedema specialists too now, full-time, who work with our patients on education, exercise, compression, skin care, and manual lymph drainage, because sometimes the swelling occurs within your lymph nodes. One of the things that they have taught me, they are wealth of knowledge. And I don't know if you guys know this, but I'll share it because they taught it to me. You can experience lymphedema from any type of surgery. Did you guys know that? You did? Y'all are smart. I did not. I was experiencing some swelling, so a lot of swelling too. And so I talked to her because she dealt with swelling. I'll ask Kathy. And she said, well, Candace, if you've had any type of surgery, and I had, you can experience lymphedema. And that's exactly what was going on. She had me buy a specialized garment, and voila, I was good. So what they do is a little bit more intensive than that with our patients, but my purpose in telling you that is that they were very knowledgeable and were able to help me, even though I didn't have a cancer diagnosis. Questions about this? No? Okay. So oncology rehab and moving on. So this is a program that most of our patients some of our patients participate in, again, after a cancer diagnosis and after treatment. It is a rehabilitation program. Many of our patients say that they are fatigued after a cancer diagnosis and after treatment, that they are not able to get their strength back up. And when I say strength, meaning just to do day-to-day activities. Maybe they can't get around the house long enough to clean it up like they want to. And so our oncology rehab program works with them. For 12 weeks, they do a specialized exercise program with the patients at the Life Center in Greenville. You do have to have a referral to participate in the program, a referral from a physician, and then you have to actually go through an evaluation with the oncology rehab team before participating. This is the Y navigation program I told you about. They just started the core strengthening program at the Cancer Institute. But in addition to this, it was created to go along with the oncology rehab program, so that patients who may not be able to make it to the Life Center would still have access to the program. So Sindel is our Y navigator, and she works directly with our oncology rehab program to provide services to patients, but at the YMCA. We also have genetics counselors, because 5 to 10% of all cancer cases are due to inherited genetic change. So our counselors are on site and work with our families to assess risk. So once a patient has cancer, of course, we can't really do anything about that, but genetic counseling does help to identify whether or not anybody else in the family might be at risk for cancer, which is nice, especially when we look at diagnoses like breast cancer. So some barriers. These are barriers for us. Not a lot of people know we're here. Lots of people know about the Cancer Institute, but not a whole lot of people know about CIOS, which is a part of the Cancer Institute, and most of these programs flow through that department. Limited reimbursement in a prospective payer system. Healthcare is still not sure what we do. Lots of people are still not sure what we do. There are there are not any other facilities in the Greenville area that offer these integrative practices that we're doing. And so many people are still confused about what we're doing and why we are doing it. So those are some of our barriers, and we do talks like this all the time because of that. We just recently got a chaplain. They'll be with us 2 days a week, which is nice, to offer spiritual support and counseling to our patients if they want it, because that's part of integrative care. You got to get it from all sides. So that was a piece we were missing until just recently. It was the piece we were after but didn't have. So, and I think that's it. So have you guys got questions for me? Any?